tonight and to cover such an important topic as we dive into February, which is American Heart Month. And it's such an important cause for women and moms to really know about and have awareness on. So really excited that we're able to feature this guest and be able to pick her brain a little bit as moms and as women on this important topic. So we are going to get to her in just a few minutes. But I want to give everybody a chance to come on in. How's everybody's week going? I hope everybody is off to a good start this week, and hopefully the snow is behind us for now, at least for a little while. I know it was a stretch there. So please let us know in the comments how you mamas are faring. Hi, Lexi, how are you? Good to see you. Hop in, and if you're new here on a Tuesday night with us, please let us know a little bit about you. We always like to start off our NJ Mom TV Live, just learning a little bit about you guys. So drop a note in the comments, in the chat, just a little bit about who you are, where you live, how old your kids are, how long you've been following NJ Mom, or how you found out about us, or if you are a familiar face, please just say hi and let us know how your week's going and what's going on in your household. So while I wait to hear from some of you there, for those of you who are new, here with us tonight, my name is Marissa. I host our NJ Mom TV Live, and this is our weekly chance to catch up with you and chat and really talk about issues that all of us can sort of relate to in this current stage of parenting, which, as you know, this past year, such a roller coaster. So if you are joining us for the first time, we're really happy you're here. If you are a regular who is back with us for another week, thanks so much for being here. We're always happy to see you. So before I dive into the chat, I always like to start off this night by just giving a shout out to all of our frontline and healthcare workers, all of our essential workers, one of whom will be joining us in a few minutes, Dr. Julie Master is our guest tonight. But all of the frontline workers who are still dealing with so much related to the pandemic and related to life right now as a result of it. So this is really our chance to say thank you. And we like to do that weekly just to give you a moment of appreciation and know that all of us at NJ Mom really value everything that you do. So thank you. We always also like to just call out a couple fun new articles that are up on the site this week. If you haven't had a chance to check them out, just let you guys in, give you a little peek on what we're working on at NJ Mom, what all of our team is working on behind the scenes. So if you haven't had a chance yet, we will drop these links in the comments for you in the chat there, so you can click on them and give them a look if you haven't had a chance to already. So for those of you who are our regulars, we do a series every week called NJ Mompreneur of the Week. It is a favorite. We always get such great feedback from you guys on it, and we get to feature some incredible moms who are both business owners and moms, and who are here in New Jersey with such great ideas and such drive and such vision and making things happen. So this week we have Megan Murphy as our NJ Mompreneur of the Week. She's a friend of mine. She is an incredible sort of, I don't even know how to describe her. The first line of the article, which I wrote, said something like, when you have 4 career titles, you know you have a lot of energy, because she does it all. And she recently wrote a book, which is what we're talking about in the article this week. Her book actually came out today. It's called Your Fully Charged Life. And Megan is actually the content director for Women's Day magazine. She is a TV talent. She is a podcast host and now an author. So give that a look if you haven't already. And she definitely supercharges me a little bit when I talk with her or read something about her. And I just started her book yesterday. So excited to see it. So we have an article up about Megan on the site. We also have another favorite article that you guys always love, which is 8 kid-friendly things to do this week. And we always feature some amazing, amazing events and things for you to check out. So if you haven't given our list a look this week yet, please do. A really great one in Roseland that I want to tell you guys about. It's called Mr. C's Train Exhibit. I know my boys were 5 and love, love, love trains. So I was excited to see that on there. It's apparently a favorite, although I had never heard about it until we featured it and called it out. So I always love seeing all of the things that the NJ Mom team finds, because there are some amazing things out there in New Jersey, and we want to tell you about them. So, and we do every week. That's there. We also have maple sugaring, which I know has been a favorite for people who try and get outside, even in this cold weather. That's going on in Hopewell this week. And actually, my kids were asking the other day, like, where syrup comes from, you know, explain and all that. But anyway, there's lots of events like that, and this one's happening in Hopewell this week. If you haven't had a chance to check out one yet this winter. There's also a really cute virtual music performance, Ralph's World. Music performance, it's virtual, and a children's performer. So if you want to inject a little music and fun today, that's an option too. I want to quickly just say hello to Anna joining us as well from Tinton Falls, mom of 2 kids. Excited to hear what Dr. Master has to say. I'm so glad you're with us, Anna. It's great to see you. And yes, I think she's going to be fantastic. And I know that a lot of moms, this is a subject matter sometimes we don't always, get as well versed in as we should. So we're going to talk heart health. We're going to bring Dr. Master in a minute. So hang on, Anna, and stay with us. And we'd love to have you here, and we'd love to see you. So thank you. One other article, actually sort of on that note that I wanted to just call out too, an article up on the site about maternal health. And this was actually an article I wrote after being able to moderate a panel recently. It was actually the Maternal Empowerment Roundtable. It was organized by friends of mine at the 2 Degrees Foundation, but it was really an incredible event where all of these organizations fighting to improve maternal health in New Jersey came together and really shared data and shared their passion for what they do and the ways that really we can all get involved in supporting mental health and maternal health. And I think that that's really the takeaway because it is something that as we need to all think about. It affects us all, and it's so important because there's a lot of work to be done. And yeah, I know we just dropped this in the comment. If you are not on our list already, sign up for the weekly newsletter because all of these articles we mentioned will be just delivered right to your inbox. So that's a great way to stay up to date with everything that we have on the site and some other fun little things thrown in here and there too. But definitely sign up for it if you don't get it yet. Okay, so I want to just encourage you all to get thinking a little bit before I bring in Dr. Matt about some questions. Anna said she has some things she wants to hear about, but if you have something related to heart health for women, heart health for moms, the way that this pandemic has affected maybe our heart health or our health and things we should be thinking about, start to get those wheels turning because we would love to hear your questions for Dr. Master. So drop those in the chat box and let us know what you guys are thinking. And if you're just coming into the live, hi, welcome. So happy to have you with us for NJ Mom TV Live. My name is Marissa. Glad you could join us on this Tuesday. And we would love to hear a little bit about you before we bring in our guest tonight and get things started with her. So please let us know in the chat box a little about you, where you're from, how old your kids are, if you're a new follower to NJ Mom, or if you've been following for a while. We always love to hear who's watching and who's joining us and who we're talking to out there. So please let us know. Okay, before I bring in Dr. Master, just one other quick thing I wanted to say. Thank you guys for tagging us in your pictures. We love to see all of the photos that you share using the hashtag NJMom, tagging us at NJMom. We use the photos for our roundups on the site and on social media, and we always love sharing. And we also enjoy using them as our cover photos of the week on Facebook. So if you're watching here on Facebook, we have a cover photos of the week contest every week. You can just comment a picture on the post that says cover photo of the week, and we choose 5 every week. So if you'd like to see it, please do that. Oh, Lexi, I love the Tuesday lives too. I'm so happy that you're with us. I know that this is something that a lot of you guys look forward to, and I look forward to it also. So happy that you're here as well. Okay, so I am going to bring in our guest now. Dr. Julie Master is the Director of Non-Invasive Cardiac Services at Monmouth Medical Center. Going to bring her in, and we are going to give her a chance to tell us a little bit about what that means for all of us who aren't in, the heart health world. Dr. Master, I'll start by just saying welcome. Thank you so much for being here. We're so appreciative of your time. We know how busy you are, and so thank you so much. It means a lot to us that you joined us.
Well, thank you so much. Thank you, Marissa. It's a pleasure being here. I think you're doing a great work.
Oh, thank you. Thank you. So first I want to start by just allowing you to tell everyone a little bit about what it is you do. You know, that title, Director of Non-Invasive Cardiac Services. What does that mean to us average mamas out here who maybe aren't as well versed in heart health as we should be? Tell us a little bit about what you do.
Well, primary, I'm a non-invasive cardiologist, so I, spend half of my time seeing office patients. I specialize in prevention, women's health, interested in, pregnancy and complications and impact of pregnancy on women's health. Half of the time I spent in a hospital seeing hospital patients. And one of my roles is kind of medically oversee non-invasive services in Monmouth Medical Center, which is part of Robert Wood Johnson Barnabas Health, which includes, non-invasive testing that we perform, stress tests, ultrasounds, and to kind of make sure that it's done up to the standards of the system.
Of course. And that's a big task. I mean, heart health is so important for everyone, but we hear in February a lot more about it. So tell us a little bit about what February means in terms of heart health and some of the things that are really important in terms of awareness that really is why we have February as American Heart Month. What do people need to know more about our heart health?
Well, I think we came a long way. I mean, dating back to, 40s when we thought it was disease of men, and, women's role in it was to make sure that her husband sees a doctor and, takes his medications. Later, we started to realize that women were affected, and it was, became known that it's our number one cause of death. And, awareness became, awareness not just of patients as well as physicians. And, over years, we learned so much more. And February is an important month for education because, women die of heart disease as much as men. And, it's higher. We die of heart disease more than any cancer combined. We always worry about our breast cancer risk. But so I think over the years, February is a good time to kind of come together and, educate yourself and help your family, your friends to understand that they're at risk as well. And celebrate our power to, take, control of our life and make changes, because 80% of heart disease is preventable. And, this is our chance to learn how to do it.
I love that. I love the idea of taking control and making it sort of that positive in this, because I think sometimes we hear some of these statistics. 1 in 3 women is diagnosed with heart disease. That's a big, scary statistic, and it is the number one cause of death. So what are some things that we can do as busy moms who often don't have time for ourselves? We try very hard, but it's difficult. We're caring for our families, especially right now. Everyone is so pressed for time. There's so many added external pressures into our lives, things that we should be thinking about off the bat as busy mamas about our own heart.
Well, I think, starting early, kind of, just getting a physical, because, we never have time. We never have time to go see a doctor. But if you think about it, you will be able to be a better mother, a better wife, a kind of a more energetic person if you're healthy, and, living a better life, and probably saving yourself a lot of time from seeing multiple doctors if you start with prevention. So I think kind of starting with, spending that hour or a little more and seeing your doctor and checking your risk factors, discussing, are you at risk, checking your blood pressure, your cholesterol, and we'll probably touch on more risk factors, but just simple things are starting early, not waiting till you are, retired and, then deciding, or not feeling well, not waiting until that point when you are sick and you're going to see somebody and trying to fix things that, could have been prevented.
Yeah, I think that's a really good point. And, you mentioned something to me when we were talking about this that I think may be the case for some moms out there. If we're in our baby stage or shortly after, there may be a few years there where we're only seeing the OB/GYN. That's the doctor we're seeing the most, but really important to have a primary care physician and be checking in, right?
Well, and our role is, well, my role as well in the system is to try to educate the obstetrician as well, that it's not just, below the waist and our breasts that we are checking on, but so trying to, yes, the obstetrician is sometimes the only time that we get in touch with physicians is during our childbearing years, and then we disappear and we deliver our children and take them to the doctors and, make sure our husband sees a doctor, but we don't always, see anybody after. But so we are trying to educate the obstetricians to kind of worry about women's risk factors and trying to kind of, if she had a father who died of heart attack or a mother who had a stroke, does she know her blood pressure? Does she know her cholesterol numbers? Did she have a pregnancy complication, which can be a sign that she's at higher risk going forward, and not having that woman disappear for 20 years until she comes back sick. So I think that's where having a primary care physician who will kind of, see you once a year, check your blood work, check your blood pressure, and discuss with you your risk factors is a first step to being healthy.
Absolutely. Let's talk about some of those risk factors, since we sort of got into it a little bit there. And you mentioned some, but tell us a little bit more in depth, because I think some of those may be unexpected to hear. A pregnancy complication. Of course, all of us are our NJ mom community. We hear something like that. What? Who knew that was related? So what do moms really need to think about in terms of what the risk factors are, including some ones that maybe are lesser known?
Right. So there are traditional risk factors such as, hypertension, and regretfully, it's, women don't know they're hypertensive for years. Unless you go and check, it's a silent killer, right? A lot of women, more and more women are hypertensive over the age of 20, probably, I would say at least 30 to 40% probably women have hypertension already. And,
wow.
Just checking your blood pressure, because we're not growing healthier. A lot of women are overweight, which is another risk factor. I would say about 60% of women are either obese or overweight at this point. And, especially in some populations, African-American women, regretfully, it approaches 80%. So being overweight increases your risk. Having elevated blood pressure, having high cholesterol. And again, unless you go and check that blood work, and every woman over to the age of 20 should know what her cholesterol numbers are, checking your sugar levels, because again, neither blood pressure or cholesterol or sugar, none of that you're going to feel. So you feeling fine does not mean that everything is perfect. So that should start early. And, other risk factors is, of course, the family history. Those things you can't change. Sometimes the family history, like having a father or a mother who developed heart disease early in life, should kind of prompt you to discuss it with your doctor, who will look for, elevated cholesterol or some genetic predisposition, and maybe counsel you how to live, healthy. So family history is important. Your sibling history, if somebody had a heart attack or a stroke or taking cholesterol medication and they're, closely related to you, you might want to know what your numbers are, because you won't know unless you check. And treating those conditions early, and it doesn't always have to be a pill. A lot of times, we'll point you in the right directions, the weight management, exercise and nutrition, where you don't always have to be put on. So being scared, I'm going to go to a doctor, they're going to open this Pandora's box and say, oh my God, you need to be on so many pills. But it's not always the case. Sometimes it's being aware. And of course, we're finding out that women who had complications of pregnancy, and sometimes women don't think of them as a complications. When I ask women, did you have elevated blood pressure towards the end of pregnancy, like having eclampsia or preeclampsia? And, a lot of, women have either miscarriage history or, preterm delivery, or having elevated blood pressure or gestational diabetes. All of those, we now understand that they're almost double, if now quadruple, your risk of having heart disease in the future, because pregnancy is almost like a stress test on your body, where, when your body is unable to carry it to full term, or, having elevated sugar kind of gives you a kind of glimpse into the future that, this is the woman who's going to be at higher risk of heart disease, because she's going to be at high risk for diabetes or hypertension. And, a lot of us are having children later in life because there's so much to do. And that, of course, when woman is older and has, already high blood pressure and high cholesterol and overweight, and then becomes pregnant when she's 42 or 40 or 39, kind of puts her at higher risk, first of all, of complications, but also and again, the woman is not just at risk during pregnancy, she's at risk for a year after. So ignoring symptoms that may happen when you came home is important not to.
Yeah. Now, let me ask you this, because that was all very enlightening to me as someone who has had, I have a very complicated reproductive history, and I also had gestational diabetes with 3 of my 4 pregnancies. But, I've been checked since and everything's been fine. Does that still then increase my risk later in life? Like I'm more than a year out from my youngest baby now, but should I be more in tune with my risk for heart disease later because of that gestational diabetes history?
So we know if you have gestational diabetes during pregnancy, you are much higher risk of developing diabetes.
Diabetes.
And
yes, I did know that. Yes.
Right. So developing, and diabetes is, almost for us equals heart disease, because patients with diabetes, they frequently develop heart disease much higher rate. So 4 times the rate of anybody else. So, if a woman had gestational diabetes and she's aware that, it puts her at risk of developing diabetes, yes, she should see her doctor every year, check her sugar, change her diet to make sure that she doesn't eat foods that, increase insulin resistance. So if you have something very sweet, or just low, high glycemic index where your sugar spikes, your insulin goes up, and your body kind of then gets more and more resistant. So there are dietary approaches where you can prevent the diabetes, and, preventing the diabetes later in life will prevent, heart disease. And if you become, many women who are diagnosed with diabetes later in life, they were pre-diabetic for years, or even had diabetes for years before diagnosis. And that's when they're building that plaque, their, vascular system is inflamed and injured. So kind of knowing if, okay, my sugar was a little high. I never knew that this is going to be a problem, but yes, it can be a problem. And it's a chance to prevent that problem.
Absolutely. It's a glimpse into what we can really control. Anna said she never knew that about preterm labor. So thank you for bringing that up. And Christina, hi, Christina, is asking she wanted to make sure she understood this correctly. So if we had preeclampsia, during pregnancy, but are now healthy, we are still at risk later on in life for heart problems. Is that right?
Right. So we think that there is, when all of those complications happen, there's something going on with the vascular system, either preterm labor or preeclampsia. So if a woman had preeclampsia or eclampsia, her risk of developing hypertension later in life is much higher. She also is at risk for a year after delivery to develop some health problems. So, if somebody had preeclampsia, even though it's, it would be good for that woman to know every year that her blood pressure is under control. that she's managing her weight, that she decreases her risk of hypertension in the future. So, and that is the way to kind of, so I'm just understanding those basic things that were slightly abnormal when we were pregnant, maybe a kind of a window to the future.
Yeah, and that's I think a great way to put it, that window to the future, and things we all need to think about. So one other question, sort of related to that. So we talked about, the importance of seeing a primary care physician. When should a woman maybe who has some of these risk factors first see a cardiologist? So, what age should we be thinking about that as women?
Well, I think if you see a primary care physician and you don't feel that they are, addressing, or, if it's a surprise to them that having preeclampsia may be a risk factor, you might want to consider seeing a cardiologist. Again, I love seeing women that, just come for risk evaluation, because, it's my chance to educate somebody, to, help them prevent, because prevention is, really what we hope to do in women's health. So but I think in terms of if somebody's pregnant, if a woman is pregnant and she's having, symptoms such as excessive swelling, excessive shortness of breath, some of those symptoms may warrant emergency room visit. But, if seeing a cardiologist after you had, preeclampsia or any complication after pregnancy, it's not unreasonable. If your mother had a heart attack when she was 50 years old or 55 or even 60, and if multiple family members, so it's, let's say your mother and her sister and her aunt, and, they all had heart disease early, or, maybe it's just something that you wouldn't want to see a cardiologist and talk about your own risk. Because, we love seeing patients who come forward with questions about prevention, not coming, when it's already they experience cardiac event. And of course, if, no matter how you think your symptoms may be due to stress, anxiety, or, don't be afraid of, getting yourself checked. If you're not feeling right, and you're thinking about it over and over again, why I'm feeling this way, maybe this is a time to go and see somebody. And, if you're having cardiac symptoms, seeing a cardiologist is absolutely appropriate.
Yeah, I think that first of all, that's such good advice. It's really never too early, is what I heard. It's really never too early to get that prevention piece of things underway, particularly if you have some sort of history, whether it's family history, a pregnancy complication, or whatever it is. So I'm going to take that advice and make an appointment. Do you see patients day to day? Is that what I understood? So you see patients from the prevention side of things, right?
Mm-hmm. Absolutely.
Okay. So that Christina, I hope that answered your question, because she wanted to know if heart disease runs in the family, when should she start to see a cardiologist? So the answer is really, now, if you're comfortable.
Yeah.
Anytime. Okay, that's good to know. Nicole, I was thinking of you, and I was wondering if you were going to join us tonight. So Nicole's one of our Tuesday regulars. We always love to see Nicole, but she had postpartum cardiomyopathy, hypertension, and her son also is a heart warrior, little Liam. Always love seeing his pictures, Nicole. But she says she sees a cardiologist now every 6 months. So dependent on what the diagnosis is, obviously that, it's something you need to talk about with your doctor. But I think it's really important to not be afraid to just go and make the appointment. And at least then, you have someone kind of like yourself, Dr. Master, looking out for that aspect of your health.
Yes. And I think postpartum cardiomyopathy is, scary presentation. And of course, all those, risk factors that we talked about, having been overweight, having hypertension. And there's a lot of things we still don't know about what somebody puts you at risk for having your heart pretty much weaken due to pregnancy. We see it frequently and see it more and more now with women getting older. And, it's our fear to miss that patient who develops symptoms and they're maybe dismissed because somebody thinks that, she's short of breath. She gained a lot of weight and she, now is so overwhelmed and she's not sleeping and, her feet are swelling because she is on her feet a lot. And, but there are certain signs that, this fear, can be very fulminant and a woman can get very, very sick. And even if she was completely healthy during, her years before pregnancy. So I think absolutely, seeing a cardiologist regularly if you had a complication like that after delivery.
Absolutely. A question from Katie, Dr. Master, is sleeping on the left side better for your heart, and is drinking water before bed beneficial? Two things that my mother is a big sleep on your left side person. So I'm curious to see what she's always said that. So curious to see what you have to say about it.
Well, I'm not aware of any studies that differentiate which side you sleep on.
Okay.
I think it's not going to hurt your heart or help it if you're sleeping on one side versus another. Yes, you can, sometimes we experience some extra beats and we can be more aware of them if we're lying on our left side and the heart is touching your chest wall. So you may be aware of certain things more, but, whether it's left or right side, for some people sleeping on their back when they're overweight may cause them to snore more or kind of
apnea.
The sleep apnea, which is another risk factor, of course.
Mm-hmm.
So it may be better for your skin to sleep on your back. But, I think, no, I don't think it matters which side you sleep as long as you get a good night's sleep.
Mm-hmm.
In terms of drinking water, I mean, most of us are guilty of not drinking enough water. And, a lot of us will cramp up at night. So having a glass of water, before you go to bed may help prevent some of those cramps. And actually having plenty of water during the day is important as well. So yes, sometimes forcing yourself, like reminding yourself to have a glass of water as long as you don't need to get up and urinate frequently if you do. But yes, drinking enough water and just getting enough sleep is the most important thing, I think.
Absolutely. And a question from Anna, getting exercise into my daily routine is difficult. Often by the time I get home, I'm too tired to exercise. I am with you, Anna. We've all been there, I think. So how much exercise is really needed to make an impact on our cardiovascular?
So recommendation is to have half an hour, 5 days a week of moderate intensity exercise. So, and what I, tell my patients, if you can fit 5 days a week and you're not doing any, start with 15 minutes, 3 times a week. And, I always say that exercise should be like brushing your teeth on your list. If you can put it on top of your list, you're going to get that task done. So if you start your morning with getting on your treadmill or a bicycle, if you can, of course, get up early enough, it's going to be done. And then you're going to feel so much better during the day. You're going to have more energy. You're going to, it's for stress and depression and anxiety, it's very helpful because it burns off those, cortisol and hormones that help us, and makes us feel good about ourselves. So it doesn't have to be, you don't have to go to Max Challenge even though there every morning. You can start as simple as either taking a walk or, riding a bike or walking on a treadmill. I'm sure a lot of us now adapted to exercising at home. Right. So whatever, doing a video or, whatever to keep yourself, not getting bored with it, and variety is good. But yes, half an hour, most days of the week. It's important, very, very important for, long-term health.
On that note, you touched on that just a little bit there, but I think as we were preparing for this, one of the things we were all thinking about is, this has been an unusual and challenging year, to say the least, to put it mildly. That's like the understatement of the year, right? So, so much external stress in our lives, so many stress factors that we haven't had before. We're at home a lot more, virtual schooling the kids, work pressures, reduced business for so many people. There's just so much on so many people's plates, but moms have shouldered so much of that burden, really. And as moms, it's been a hard year, stress-wise. What are some suggestions you have for helping that, and how important is it to control our stress levels for our heart?
Well, the stress affects your heart, it affects your blood pressure, it affects your sugar levels, and, even your cholesterol. I mean, when we under stress, our adrenaline goes up. When, the cortisol level goes up, it almost like squeezes all the arteries in our system. And it translates into, elevated blood pressure and, just kind of sheer stress on your blood vessels during that time. So to manage stress is important. It's not always kind of easy to figure out how to manage the stress. I mean, maybe you don't have to be perfect, you don't have
Thank you for someone saying it, right?
Yeah, you don't have to have that kitchen counter scrubbed to, you don't have to have everything done, sometimes you can, remembering to care for yourself a bit, because if you're going to fall apart, you're not going to be able to take care of your children and be a good parent. So, and that's where exercise, I think, fits in, because it helps you, it manages stress. Besides just you will be healthy, you will have more energy. And sometimes it feels, but I'm so tired, I'm so stressed out, I can't really fit it in. But it will help you have more energy. And, social connections are important, especially during this time, because, having, groups, we can't see each other and hug each other and be together, but you can be together in platforms like this, where you can discuss things that worry you and, help others sometimes, hear somebody out. Mental stress has been on the rise, and women, regretfully, the domestic abuse has been on the rise as well, because we're stuck in one place. So I think kind of having a community, whether it's, church or a community like this, helps with relieve stress. And, and again, trying to be outside when it's nice, trying to, spend time with your loved ones, whatever platform it's on, and, listening to music and, eating healthy, because if you're, already under stress and your nutrition is bad, you're not going to feel well. And sometimes, getting help and talking to somebody, even professional, if you feel that you can't handle the stress. And women are, represent a large portion of frontline, workers, because of, our, being nurses and, teachers, and then coming home and, making sure that the kids submitted their homework, and, it's a lot. So trying to find an outlet is important.
Absolutely. I love all of what you just said. I think it's so, so true. It's so crucial to find that opportunity to let out what we, take on and take in as women and as moms. And yes, that's like the goal for us here at NJ Mom. We hope that, this every Tuesday offers that to our NJ Mom community, which is why I'm so happy we have you here, because it allows us all to kind of talk about these things together. And it does help stress levels. It helps when you get that validation from another mom who is feeling the same. So I totally agree with that. Another great question from Katie. Is it true that HDL doesn't play a big role in the lipid profile? So first explain, if anyone watching doesn't know, what is HDL? And then if you could answer Katie's question, that'd be great.
So when you get your cholesterol panel from your doctor, they give you a total cholesterol, which is a sum of parts. So we look at a good cholesterol, which we want it to be high, which is HDL. So HDL kind of goes around and picks up that bad guy and brings it out of your system. So the higher the HDL, or we want it to be high, the more protection your body has for, from bad guy, which is LDL, or lousy cholesterol, as I call it. So we want your HDL to be, if it's above 40, it's great, but if it's above 60, it's protective. So the higher the HDL, the better. A lot of it is determined by your genetics. So, some will have very low HDL, and that's a risk factor. And having high HDL is a protective factor. So, but exercise, and not smoking kind of raises your HDL. So, and genetics, of course. So HDL is an important, part of your cholesterol panel. The LDL is the, our primary target, because it's allows the bad cholesterol, which we want it to be under 100 for if you don't have any history of heart disease. And, sometimes the HDL will balance the bad guy out, but depending how high is the bad guy. So the higher the bad guy, the less protection you get from HDL.
That's I think a really good way to break it down. You always hear the term like good cholesterol, bad cholesterol. I know for me, like that's been said to me before, is that my lousy cholesterol is not high, but but it's maybe a little elevated than they would like, but because my HDL good cholesterol is much higher, it does sort of make it protective, which is I've never had it explained to me that way, but that makes so much sense. So thank you. Okay, want to just make sure to shout out if anyone else has any questions for Dr. Master before we start wrapping things up. Please drop that here. Nicole, I see you saying a lot of stress being a nurse. I can only imagine how incredibly stressful this last year has been. So I know that you work so hard and you take all those kiddos. She works in a pediatrician's office. So you're right, Dr. Master, that the frontline work, it's an unimaginable from both sides, the stressful situation. So okay, so I have one more question for you before we see if anybody else has any thought. Any sorting words for us moms to really think about in terms of things we need to be doing, every day to really keep our heart health kind of just a priority, and sort of, maybe in the back of our minds, and kind of always just something that we're checking in on. What do you advise your patients to do?
So I think, again, getting a physical every year to uncover those asymptomatic, risk factors, and discuss your family history with your doctor, get your cholesterol check, your blood pressure check, knowing your numbers, as we say. Another factor which is important to understand that, women who had cancer in the past, or even had cancer as children, it puts them at higher risk sometimes of heart disease because of the medications that were used. So that's another, if a woman had treatment for either Hodgkin's disease or lymphoma as a child, or any, breast cancer therapy, considering having your heart check, even if it was not recommended to you years ago when you went through that therapy. So kind of understanding your risk factors, your family history, your cancer, your pregnancy history, understanding how it affects you. And then every day trying to, eat healthy, more Mediterranean style diet, not a lot of processed food, and, bright fruits and vegetables that have all the antioxidants you need. Trying not to drink excessively, especially this stressful time, understanding that a woman gets one drink a day. If you're drinking more, you're increasing your risk of having hypertension and developing heart that can be weak, and trying to exercise and take time for yourself and, distress and, take care of yourself.
I think that's also important to think about, and just great things to think about for overall health, but particularly as we talk about heart health. Thank you so much. Anna, just wanted to say thank you so much, Dr. Master. This was such an informative session. I agree, Anna. I learned a lot, and I know all of our moms did too. Just want to make sure to scroll up real quick to see if we had any questions that I didn't get to. Oh, Irene says, great information. Love to hear and learn from you. Awesome. And Tatiana saying hello, happy to hear and see you. So glad you all could join us and be with us for this, because Dr. Master just gave us so much good knowledge and so many things to think about. Christina said, thank you, learned so much. Nicole, wonderful talk tonight. All right, Dr. Master, well, thank you so much for sharing all of this with us. Any just final thoughts for all of us to think about in terms of February Heart?
I would say spread awareness, talk to your mother, your friends, and try to, ask them certain questions that they maybe didn't ask themselves. But thank you so much for having me. I think you have a great talk here.
Oh, thank you. Oh, Inna said, Dr. Julie, you are great. Thanks, Inna. You were fantastic. Really appreciate you being with us. And I don't know if I mentioned this at the beginning, and I apologize, but in addition to all that you do, you're also an NJ mom. So, just superwoman over there. Really appreciate you taking time out of your busy schedule with us.
Thank you.
All right. Have a great night.
You too.
Take care. Bye-bye. Awesome. Yes, Heart Month, it is important, Nicole, and I'm glad you could be with us tonight. And I'm so glad that all of you were able to hear from Dr. Master and hear all of the really important tips that she had to offer. Really interesting takeaways, particularly about, those, pregnancy conditions that play a role in all the things we need to think about in our life, and everything that plays a role in our heart health. So really happy you guys could join us tonight. And as always, please let us know what you would like to see and hear about next week. If you have any ideas for guests, please send them our way. We always love to hear what you guys are wanting to talk about. So please drop us a note and let us know if you have any ideas for us. And as always, thank you so much for being with us tonight. It was awesome to have you and talk heart health. And go schedule a workout, go do a meditation, go take some time for yourself, go think of a healthy breakfast for tomorrow. We're going to kick off tomorrow thinking about our hearts, because it is so important when we have to take care of each other and we have to take care of ourselves. So with that, good night, mamas. I will see you again next week. Take care.